joining us on this webinar. Today we'll be talking about something that we all need to pay more attention to. That is if we want to increase our income, and that's patient reactivation. So just before we start, Greg, you've had your practice now for how many years?
I have actually practiced in Columbia, South Carolina for 25 years. I had a solo practice for about 20 years, and then I moved into a couple of other practices about 5 years ago.
Wow. So you've been doing this for a long time, and I know you've been implementing different marketing strategies, systems, and techniques for a number of years. And, of course, the one we're going to be talking about today is patient reactivation. So here's the question for you. Why is patient reactivation so important for any practice to really get involved in?
Well, the first thing is these are people that already have a relationship with you, and probably more so with your staff than actually with you. No dentist wants to admit that, but these are people who have been to your office. They know the surroundings. They know the staff. They've interacted with a few staff, maybe had their teeth cleaned. Maybe you've done a little bit of work on them. So they already have a relationship with you. When you look at the cost of acquiring a new patient versus reactivating an old patient, the cost of a new patient can be at least 10 times what it is to already reactivate somebody who's on your list. These are people that have diagnosed treatment. You've already presented a treatment plan to it. These are probably, if they've sort of fallen out of your system, folks that have significant need, and they're probably already aware of their needs. And if you really want to look at treatment plans or figure out different types of people you want to target, these are people that you can easily target.
Yes, that's for sure. Like you said, they do have a relationship with you, and I guess the real biggie is the patient acquisition cost. So that's just a huge, huge benefit. So now, why is it more profitable? Well, we covered on it a bit, but obviously the patient acquisition cost is really, really important.
Yeah, for us, I spend between $150 and $250 for a new patient when I start figuring out all the things I do, some radio, TV, some direct mail, and different print ads I place. And reactivating a patient, if you do a few steps, it could be a couple of bucks, maybe $5 or $10. So you don't have to spend near as much time with this reactivated patient, because you've already got a relationship with them. The doctor doesn't have to go in and pitch himself. The patient already knows a little bit about you. A lot of it can be a lot more staff-driven, the appointment. If you're bringing in people who maybe have fallen through the cracks and you're bringing them into your hygiene department, then your hygienist is the one who's representing the treatment plan. It's already been diagnosed by the doctor, and all the doctor really has to go in is establish a little bit of rapport with the patient, thank them for coming back, and just reemphasize the treatment plan. But the staff has already done most of the work for you.
We were talking a little bit earlier about doctors taking a look at their appointments and saying, gee whiz, nothing's here, I better start reactivating patients. But by then it's almost too late.
Yeah, and I'm the first to admit I've been guilty of this kind of mistake all the time. Most guys, about September, maybe things will slow down a little bit. They'll look at their appointment book, and then they'll look at their office manager and say, oh, we got to start reactivating folks. And that's really the worst time to start doing it, is when you're at a slow time. The first best time to do it is in advance of a slow time. If you know historically that maybe September is a slow month, maybe June or July is a slow month, a few months before that, starting a reactivation campaign. But really the best way to do it is to figure out when somebody is overdue for a cleaning, when they've missed a cleaning. And for most of us, that's 6 months and a day. So when somebody has missed their appointment, or they're not on the appointment book after a 6-month cleaning, or they have significant need, that's when you should start reactivating them, right when they're overdue.
Okay. Now, as we know, reactivation is really a campaign. And, we need to capture a patient's attention. Now, you're very, very good at this. So you just want to tell us a little bit about your reactivation campaigns.
You know, pretty much every dental software has some sort of preformed templated letter that you can mail out to a patient. And it's about as boring as it gets. You know, a lot of people will just send out a letter on their own stationery and on their own letterhead. And you know, that's the kind of thing that's easy to get ignored because, you know, whether we want to admit it or not, we're not on most people's radar most of the time unless they're in some sort of a crisis. So what we like to do is something that a lot of people call three-dimensional mail, some people call lumpy mail, and it just helps get our stuff noticed. You know, this is an envelope that's bulked out, or some crazy box type thing, or something like that that really entices the patient to open up your mail and get them to read your message.
Well, let's just talk about a couple of the reactivation campaigns that you do, and you've tested out, because I know you've tested out a couple of them. And one is your boomerang letter campaign.
Yeah, this is part of a three-step campaign, and we've done this a lot, especially with hygiene patients. And the first step is basically this letter, and we make sure to tell them that it's not their fault, it's never their reason to that they've missed their appointment, and then we give them some reason why. And then what we do is we put it in an envelope that's a little smaller than an 8.5 by 11 envelope, with a big plastic boomerang in it. And again, it's something that kind of bulks out, it stands out, it kind of rattles around in the envelope, and it gets people to notice it. And whenever we send out something, we always try to justify it in the letter. You know, just like this boomerang, here's your, we want you to return.
Right. Now, obviously, this letter goes on a lot longer than this. But this is part of a three-step campaign, and so there's a second letter that goes. Now, what's the time frame in between the first and second letter?
Usually it'll be about 2 weeks later. We'll kind of play around with it. Sometimes we'll call somebody, or we'll try to telemark it maybe before we even start sending out letters. And then maybe somewhere in between the second and third letter, we'll try calling them again. Usually about 2 weeks later, we send out the bug letter. And this, again, is just a regular envelope with a big, furry, rubbery little bug thing that bulks out the envelope. So, you know, if somebody gets a stack of mail, this one has to sit on top, because if they put any letters on top of it, they fall off because the envelope's all bulked out. So, and, you know, it kind of rattles around in there, and it's bulky, and you think, well, you got to open up this just to see what it is. And the second thing, again, you know, it's we always make sure to tell them it's not their fault. We don't want to let them down. And it's just another way to get them to open up the letter.
Now, if they don't do anything after this letter, another 2 weeks, you send them a third letter.
Yeah, the whoopee cushion letter. Whoopee, your waiting is paid off. And these are these little rubbery whoopee cushions that we probably, this will always get somebody's attention. And again, it's just a little flattened plastic thing, but in a little bag, and it, you know, it rattles around. And at this point, we make a what we call a shameless bribe. You know, so many cosmetic places, they'll sell gift with purchase, or you can go into a place and get a free gift. You know, a bank is always, you know, you can get a toaster or something. Well, we do the same thing. We just bought a bunch of different premiums. It's amazing how inexpensive these are, but they have a nice perceived value, and we just offer somebody a gift for coming in. Honestly, most people have responded by the second letter, and so we don't have to send this one out very often. But again, it's something that gets people's attention. You know, we joke about it and make light of it, and give them their little gift and let them choose whether it's a stadium seat or a vacuum cleaner or a little tool kit, or, you know, we have a bunch of these little goofy products that cost us almost nothing, and they have a high perceived value, and it kind of gets people's attention again.
Okay. Now, you've told me that you have a favorite one. We're telling that right now, and this is the Chinese takeout box mailer.
Yeah. This one, you want to talk about some lessons. This taught me a lot of lessons. First of all, I have been my main practice in Irmo, South Carolina, 25 years. I have been in practice, there's a Chinese restaurant right next to me that I have been in practice 10 years before this Chinese restaurant opened. But whenever I give out directions, everybody knows where the Chinese restaurant is, but nobody knows where I am. And it's a nice restaurant. So so everybody knows the Chinese guy.
Oh, that's
So
because
we
they have to
got
eat more often than they have to go to the dentist.
yeah, you know, and some of the windows look right out at the Chinese thing. And but so what we did was we sent out a reactivation letter in this box, and we actually sent out a couple of postcards afterwards with pictures of me kind of looking for them, shading my eyes with the Chinese restaurant in the background. But the box came, we got a bunch of these little takeout boxes, and we got a bunch of little fortune cookies, nothing customized, just something to rattle around in the box, and then a letter. And you know, one of the things that I really learned from this, when we took this box to the post office, you know, I wanted to kind of test mail a few to make sure that they would survive the post office. We went to our local post office that I've mailed with, you know, forever, and first thing they said was, we can't mail it. No, we can't mail something like this. So of course my office manager has been with me like 15 years, you know, I mean, and most staff, they just gave up. They said, oh, I can't do it, have to do something else. And I said, no, let's take this to another post office. So we went to the main post office in Columbia. And again, same thing, we can't mail it. So then I took it to a third post office in a town called West Columbia, which is a kind of a blue-collar town, maybe 20 or 30 minutes away from my office. And no problem. You know, they just took it and mailed it, and they survived. I test mailed a couple just to my house and my staff to make sure that they would survive, and they did. And then we sent these out to patients. And talk about something that gets your attention. This really got people's attention.
Well, that's fantastic, and that's where most people fail. They, you know, get their staff involved. Staff say, "No, can't do that," and so you say, "Oh, well, can't do it," or your staff will talk you out of it because they say, "Ah, it's not going to work. It's silly," because it's more work for them too. So
it's more work for them, but you know, yeah, you just don't want to be boring. You want to have fun with it, and you know, the biggest sin you can do in marketing is to be boring. So Sunming is the restaurant next to me.
And of course, you had this little letter on the inside. Remember the great feeling of clean, fresh breath and a healthy bite, and you know, we want you back. So basically the same type of letter, but just a little bit different approach to get them to open it and read it and remind them that, hey, you are there and you should be coming back.
Well, if you get a Chinese box in the mail and something rattling around inside of it, I guarantee it, you're going to open it.
So these campaigns have been working well for you.
Sure. We just keep doing it, and the big thing for us has been automating it so that when somebody is overdue, we just start cranking it out. You know, we don't wait. So
you've got a system in place for your staff to really get on top of this.
Yeah, and there's a lot of different ways to do it through your dental software, but the big thing is just, you know, you just can't wait till you have a slow time to do it. You just have to make it part of the deal, part of the system.
Okay, and you also put in a gift coupon.
We always make an offer in the reactivation letter. A lot of guys, you know, it's not like hygiene is a huge profit center for you, or a lot of guys don't like to discount exams or discount their time. But, you know, to bring a patient in through hygiene, when, you know, hygiene is kind of an easy entrance for most people. Everybody knows they need to get their teeth cleaned. Everybody knows they feel better after they get their teeth cleaned. You know, we always make some sort of an offer, whether it's $50 off or a freemium afterwards, or $100 or a percentage off for a significant treatment. We always make some kind of offer.
That's great, and I think that that's just another step in the process where a lot of dentists just figure they can open their practice, and patients are automatically going to come to them. Patients are automatically going to make their own appointments. They're always going to remember you. But it's a lot of work to reactivate patients. And I think, the big thing is you have tried different things here. You found things that work for you, and you've put a system in place so that, your staff can more or less get it done for you. So there's one more step in this sequence, though, and that's the follow-up phone call.
We always follow up a step with a phone call. One of the neatest things that I've ever done in reactivation, one of the most successful, has been a letter from the hygienist that the headline is everything okay? And this is Marie. I was your hygienist at your last cleaning. I see that you've missed your appointment. I'm just checking up on you to make sure everything's okay. Of course, there's an offer in it, and the letter is much longer than that, but there's an offer in it, and then Marie or a representative from Marie, usually the hygienist if they can, will follow up with a phone call and find out from the patient. And lots of times, just something like this, you hate to say that you're preying on people's guilt, to get them to make an appointment, but you're preying on people's guilt to make them an appointment. It's what's good for them anyway, and it's amazing the response that we've gotten from folks just for that. Not that we're trying to make them feel bad, but just that we feel bad that did we make a mistake, or was there a problem with, and is that the reason they didn't come in? And that's gotten a response. Just people calling up from that letter saying, oh, everything was okay. I just was on vacation and I missed my appointment and I'll reschedule or whatever. Well, I just want them on the appointment book. I don't,
That's right. And like you said, in the end, it's best for them anyway.
It's the best thing for them.
Well, Greg, thank you so much for joining us today, and thank you for sharing the information. And if anyone wants a complimentary market analysis, they can give us a phone call at 888-909-9916, and just dial extension 102, or they can email me, ron@yourinternetdoctor.com. Greg, once again, thank you, and we'll be talking to you again.
Great,
Bye
Ron.
for now.
Thank you very much. Bye.